So what we've observed is with your left side pain that you're having on that SI joint, that one of your ASIS or this knot on the front of your hip is out of line with the other. So what we're gonna try to do is a little bit of movement. We call this mobilization with movement, and we're gonna try to do a little bit of movement to see if we can help normalize that or correct that hip side. This is gonna require me to put my hands over your backside, over your tailbone area, and my front hand over your hip. Just gonna make sure that you're okay with that. And as I place my hands in a position, if it's uncomfortable, just let me know, whether it's a painful area or you just don't feel good about the area. Are you okay with me placing my hands there?
Yeah, you can touch me.
All right, so if you want to start by laying on your stomach, please. Just gonna try to get you to slide close to the edge of the table right there, good stuff. Okay, and so what I'm gonna do is I'm gonna stabilize your pelvis, and then I'm gonna have you do a press up. So if you wanna show me what that looks like here, good stuff, all right. So you're just gonna press up until you have pain or until it gets to that stopping point, but you shouldn't have any pain with this, but if you do, just let me know. All right, so stabilizing that area there, you okay with that?
Yes.
Okay, and then I'm gonna pull up here. So we're gonna do a little bit of a pull up, push up there, and we're gonna do 6 of these. Feeling okay there?
Yep.
All right. We're gonna take a rest, and we're gonna do 2 more sets of those. All right?
Okay.
So the pain you've been having in your SI joint could be due to one of your hips kind of shifted in a different direction. A lot of people don't think that your pelvis can move like it does, but it does have some really neat motion in it. And when you tilt on one side or the other, it can cause some pain there. So what we're gonna do today is a little bit of mobilization with movement, where I'm gonna stabilize a part of your pelvis, and you're gonna move into a cobra position. And but this is gonna require me to have my hand over your backside area, over your PSIs, that little dimple on your back. So I'm gonna have to hold that and stabilize it. If it gets uncomfortable at all or you start to have pain, just let me know, and I'm gonna make sure that you're okay, that I have my hands in that area. All right?
Okay.
So if you wanna start by turning on your stomach, and we're gonna get close to the edge, good, right there. So we're gonna be going into a cobra or a prone press up. So you're just gonna push your upper body up as far as you possibly can, or until you're in a painful situation. But I'm gonna stabilize right here over this area. So I'm gonna find your PSIs, this little dimple here. I'm pretty much gonna do a CPR over top of that.
Okay.
Only no thrust. So if you wanna come on up, we're gonna do 6 of these. What are you feeling there?
Feel it deep, kind of stretching.
Gotcha. Okay, we're gonna take a rest there, and we're gonna do 2 more sets of those. All right, we're about to do a little bit of muscle energy technique to try to help correct some of that hip motion that you're having there. This is going to call on your glutes and your hamstrings to kind of recruit that energy to help correct this hip that's out of alignment. So it's going to involve me getting really close to you and into your space. So just need to let you know that this is going to be, I'm going to be in between your legs at a position. I just need to make sure you're okay with that.
Yes.
Okay. So if you want to come up to the side of the table, lay on your side.
Okay.
This leg is going to just go straight to stay stable. Slide a little bit closer there, you're good. Okay. I'm going to just let you get comfortable there. Well, how this will work is you're going to press against my force about a 2 out of a 10. So not a lot, just kind of activate those glutes a little bit. And then when you, I'm going to resist you for about 6 to 10 seconds, somewhere around there. And then I'm going to further stretch you a little bit. And I'm just going to ask you to inhale and exhale deeply and just relax completely on those stretches. As we move through, we'll do 3 of those, and on the very last one, I'm going to hold you in that position for a little bit longer, approximately 20 seconds, just to kind of set that position, okay? So first off, I'm going to find where that bind is at. Okay, right in there. Okay, if for some reason you feel uncomfortable with the way that I'm pushing on your hip right here, your bone, it just hurts, then I can change hand positions. Just let me know, okay? So first we're gonna start off pushing against me right here. Push 1, 2, 3, 4, 5, 6, and inhale deeply. Exhale, completely relax. And I'm gonna try to pull it around here. Okay there?
Yep.
Okay, push again here. 1, 2, 3, 4, 5, 6, and relax completely. Deep breath, good. And inhale again. Ready, push against. 1, 2, 3, 4, 5, 6. Completely relax. Okay. Relax that. Alright, so since your pelvis is a little bit tilted, we're going to try to do a little bit of mobilization to try to see if we can help correct that on the one side. And I'm going to have to put my hands into your hip area and on your glute area. Just want to make sure that you're okay with that. And I'm going to apply force to your low back area and your hip area. You just let me know if that's uncomfortable or if there's anything that we need to change up. You shouldn't have any pain, and you should have instant relief feeling. So if you want to start by laying on your side, facing me. There you go, get comfortable there. And we're gonna pull like this leg straight, and this one's gonna come into this space here. And the way this will work is I'm gonna push here on your PSIS, this little dimple over your back, and I'm gonna push here on your ASIS. And so I'm gonna apply a little bit of pressure there. And if you're at all uncomfortable, feel those.
Yeah, I feel it.
So as we've been treating, you have some right SI joint issues, and what we're going to try to do today is a mobilization to see if we can open up that space and kind of help increase that range of motion for you. The idea here is that you may hear a pop, maybe not. It's not necessarily a have-to thing, but we're just trying to move that joint space just slightly so we can open up that and create a little bit more motion. What it'll involve is me putting you in a kind of a banana position, and I'm gonna have to put my hand on your hip and put my arm behind your shoulder to kind of help stabilize you, and then I'll just ask you to focus on your breath and try to relax as best you can. All right, so if you want to lay flat for me, please. And we're gonna treat that side over there, so we're gonna make sure that we're crossing this right leg over, and I want to move you into a little bit of a banana position there. If you want to hug yourself so sweetly, and I'm gonna put you in that position. Try to breathe, start getting into that breathing pattern here, deep breaths in through the nose and out through the mouth. And I'm going to stabilize here on this hip. If this is uncomfortable at all, please let me know. I can place a towel or something, but I'll try to just use a pad or palm of my hand. And then I'm going to try to pull you into this position here. As we get into this position, just keep focusing on that breathing. I'll just try to push you down there. Deep breaths. If we need to, we can switch to the other side and do that side just to balance things out. Right? I have to be honest with you. Hip, low back, probably SI joint is one of my weaker areas, just being fully transparent. I have a really hard time grasping the idea that the SI joint has as much freedom as we're demonstrating. I do understand that it causes problems and that the shear force is there, and there is injuries to that site, to the ligaments, and possibly overworking the musculature in that area because of the ligament weakness. But it's just,
I am a mechanical thinker, and I kind of have to know how things work. And the videos were somewhat helpful as far as the kinesthetics and how the joint moves, but it's just really hard for me to wrap my head around how the SI joint can move as much as it seems that we are influencing it in these practices. I know 1 degree to 3 to 4 degrees, some literature says, but it's just hard for me to see that, you know. And so I get what we're trying to influence. And what I've most frequently got, my wife just gave me feedback on a lot of this techniques that I used, was that she either feels it in a different area, or that she doesn't feel it in necessarily the tailbone or SI joint area. I could feel some movement when she was doing the prone press ups or the cobra. The manipulation, that one just whipped me, because I practiced that one multiple times before I did it on video, and it was almost like I was crunching her opposite side, if that makes sense. She said she didn't really feel it down in the SI area as much as she did in the lower oblique area, I guess you would say, or hip area. But anyways, it's just, I struggle with the idea of that much freedom of motion. I'm open to give these shots, and especially, you know, if I have a patient with some SI issues or even low back issues, maybe see if I can attribute some of that low back pain to that SI joint. I'm more open to it. It's just I really struggle with the idea of that motion and mechanical movement. Any feedback is welcome. I'm open to anything, to be honest.